Hello, this is our design for an arterial sheath for the treatment of thoracic outlet syndrome. My name is Elzani Fonsale.
My name is Greg Mollica.
I'm Kate Riley.
And I'm Elizabeth Wallfield. So first we'd like to start with going over what thoracic outlet syndrome is. It basically describes compression of any of the structures in the thoracic outlet. So the thoracic outlet, as seen on the right, includes the brachial artery, the brachial vein, and the brachial plexus, which is a nerve that surrounds the artery. These structures are situated in between the clavicle and the first rib. When the scalene muscle pulls up on the first rib, these structures are compressed. There are two different types of TOS, neurological or vascular. It is reported to affect approximately 8% of the population. Its symptoms include pain or aches in the neck, shoulder, hand, poor circulation, numbness or tingling, and arm fatigue. All of these decrease quality of life. The current treatment involves resection of the first rib. The drawback to this is that about 72.5% of the patients are still limited in activity and have residual symptoms after the surgery. So we have identified a need for a device that prevents rib removal and provides more effective relief from symptoms.
Our approach is to develop an arterial sheath that would go around the artery and protect it from the compression. So the outer layer is made out of nitinol, which we'd be then able to implant in a U shape, and as it responds to the temperature, it would move into its cylindrical shape. On the inside, it has a silicone layer which would allow the artery to still palpitate normally and not be hindered in any way. The silicone would be adhered to the nitinol while it's in its U shape, so that when it's implanted, the silicone would move with the nitinol. We also have a locking mechanism in the nitinol which would prevent it from slipping when compression is added onto it. So it's kind of like a zip tie method. You would be able to move it into its cylindrical shape, but not be able to move it out of its cylindrical shape. It also has a PLGA coating that's loaded with Biolumis A9 drug, which is a drug that would prevent any type of protein adhesion to the surface of the nitinol.
So normally the surgery for thoracic outlet syndrome is pretty invasive because and to remove the first rib, and normally the incision is here under the armpit or right between your shoulder and your neck. With our device, it would only be a surgery from the neck because it's minimally invasive and it doesn't require the removal of the first rib. So this benefit gives our device a faster recovery time and a higher chance of success. The cost of our device is that the cytotoxicity of the nickel can cause tissue necrosis, and nitinol actually requires cold treating within the body, so we're going to need to figure out a way to shape it outside or within the body so it doesn't cause tissue damage. Lastly is the slippage of the device. There's some concerns that the device may slip when it's not in compression, and this is something that further experiments are going to have to be done in order to evaluate slippage of the device.
So the competition for our device includes both rehabilitation methods and surgical intervention. For rehabilitation methods, there's physical therapy and there's pain management medication. And every TOS patient ends up having to go through some sort of physical therapy or pain management. And one of the more recent studies looked at Botox injections. However, there was no evidence for long-term relief of symptoms when the Botox was injected into the scalene muscles. For surgical intervention, there was the rib resection, as Liz and Greg said before, and that has varying success rates. And there's also a lot of complications with surgery, including pneumothorax from collapsing the lung, nerve and vein injury, and hematomas. A study that included something similar to our device was an implantation of a stent graft here in that lighter gray area, along with a first rib resection. And all 3 patients that received this treatment did have successful short-term symptom management. However, there was no long-term study done, so this study was relatively inconclusive for long-term results. So our device provides a better alternative for pain management, as well as preventing the resection of the first rib, and improves quality of life.